Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And here at Gold, we have started our Gold Lactation online conference of 2020. And what we like to do here at Gold is check in with our speakers and chat a little bit with them about their work, about their professional background, and of course, about the presentation. And with me here today is Rob Reed. Welcome, Rob. It's so nice to have you here with us.
Thank you for having me.
It is wonderful to see you here today. And first of all, I would like to ask you, how are you feeling? You were quite sick, and we appreciate that you made time here for us and still coming out here today and meeting us in our online meeting room. So tell us a little bit, how are you feeling?
I'm doing much better. Thank you so much. I appreciate you asking.
Okay, it's good to know. It's good to know. It's definitely difficult times right now. So thank you for being here with us today.
My pleasure.
So let's chat a bit about you and your background. You are a professional midwife, right? Where are you located?
Yes, I am a certified nurse midwife working at a busy urban hospital in Seattle, Washington, in the United States.
Hmm. And let me ask you this: we're of course in the middle of still of the Corona situation here. So what have you seen in your community?
Yes, Seattle was one of the first
Hmm.
hotspots in the United States,
Hmm.
and our hospital is definitely prepared for an influx of patients. Although, some good news, it seems like in Washington State, it appears that we have already reached the first peak of
Hmm.
the virus in our state, and our numbers are starting to drop again now. We're optimistic that people will continue their social distancing and
Hmm.
um, safety practices to keep the spread of the
Right.
virus low. But definitely, we have seen a large number of cases in King County in Washington, where I am.
Mhm.
And it's thankfully not reached the point where it has swamped the healthcare system, although it has been something that we've all been prepared for.
Wonderful to hear also that the numbers seem to be slowly going down. So there is some hope there, right?
Yes, thank
Oh,
goodness.
that's wonderful. Now let me ask you this: have you had an influx of calls because after many pregnant families of expecting families might not feel safe to give birth at the hospital, and have they been reaching out to you in your practice?
Yeah, so I do deliver in the hospital. So all
Okay.
of my patients are planning hospital births.
Okay.
But we have had a number that have considered transferring to out of hospital,
Hmm.
or obviously, all of our families have questions about
Right.
giving birth in a hospital and how we are helping to keep them safe
Hmm.
from contracting the virus while coming into the hospital.
Hmm.
Um, and also, if they were to have symptoms, what that process would look like. And so we have lots of conversations about staying healthy during pregnancy, avoiding contact with people who are sick, hand washing, wearing a
Hmm.
mask, all of that, as well as discussions around safety after birth and with a new baby, staying home as well.
Hmm. And let me tell you, thank you so much for the wonderful work you and your colleagues are doing there in the hospital and still providing for these families and making sure that they still have a wonderful experience during their birth.
Absolutely. It's important to all of us to make sure
Yes.
that we know that this is an intense and stressful time
Hmm.
for families who are expecting a baby and
Hmm.
going through all the uncertainty, as well as the isolation from
Right.
their support people, and concerns about isolation postpartum and not having the hands-on support and contact that they have been
Hmm.
expecting, or people with them in labor that they were maybe hoping that they could have multiple support people, and now they might just be
Right.
down to their partner and their doula, but
Right.
their mom or sister couldn't also be there. So lots of changes that we're working with all of our families to help them cope with the intensity of that process, as well as all of the changes throughout pregnancy and birth and postpartum.
Absolutely. That is good to hear that you're really intensely working with the families there. It's wonderful to hear.
Yes.
And so moving on, you are You're also specializing in helping facilitating birth and lactation for the LGBTQ plus community.
Mhm.
And so tell us a little bit about that work you're doing.
Yeah. So our practice, obviously Seattle is a big urban area, and there are a large number of people who identify as LGBTQ who live in the Seattle area, and many of them want to have babies. They want to
Hmm.
build their families. So during the time that I've spent at my particular practice, I've done a lot of work to make the practice itself more inclusive to all of the families that reach out to us to take care of them during their pregnancies, as well as their healthcare in general, even if they're not pregnant or planning to be. So we've taken care of lots of lesbian, queer, um, gay folks, transgender, and non-binary people, whether that's for prenatal care, birth, postpartum care. I've worked with transgender women and trans feminine people who have wanted to induce lactation to be able to breastfeed their babies along with a partner who might be carrying the pregnancy,
Beautiful, beautiful.
as well as transmasculine people who may or may not have had top surgery, but who are pregnant and carrying
Hmm.
their pregnancies and are have questions about their options for lactation, whether they do or don't want to breast or chest feed.
Absolutely. Sounds wonderful. Thank you for sharing that. And many lactation professionals or professionals who work in the field of, birth and lactation have a desire to really care and use the right language. And many still have a lot of questions, right? Do you get a lot of questions from the community, from other care professionals?
I do, yeah. So
Mhm.
one of the things that I have done is consulting work with other area hospitals or practices, as well as individual midwives and
Mhm.
lactation providers on how to use inclusive language, whether
Okay.
it's in their marketing materials, their websites,
Mhm.
their using family-friendly um, pictures in their marketing
Right.
materials,
Yeah.
and inclusive in an intersectional way. So not just for our LGBTQ families, but for families of color, people with
Hmm.
disabilities, many other families with special needs that might not have their family structures represented in
Right.
otherwise very cisgender, heterosexual focused marketing.
Right, absolutely. Oh, that's wonderful to hear to that you offer these services there to the community as well. Yeah, I have to tell you, I'm a part of many online groups, also especially now with the COVID-19 situation. And one of the first groups had put out inclusive language that there was their standard, instead of, let's say, use pregnant woman, use pregnant person or
Mhm.
parent, things like that. And there was I was interested to see the discussion that followed from that post. And many of the care providers were excited and saying, like, yes, I am already using this language, or yes, oh, I learned something new here. I wanted to I need to expand my vocabulary here and my language, make changes to my language, which was really interesting to see the discussion there. And there was still a lot of questions
Mhm.
regarding language. For example, do we completely replace the language, or is it okay to say pregnant woman and parent or pregnant person?
Mhm.
So that was really, really interesting to see in that regard.
Yeah, I've had a lot of conversations with people both in online groups as well as one-on-one and in professional settings around language and how we make language more inclusive. And the goal of inclusive language is not to exclude people.
Hmm.
So we're not trying to say you can never say the word woman or
Right,
breastfeeding. Like those are
right.
important um, words, and the language around giving birth is so gendered that
Hmm.
what we're trying to do is include people who don't feel that the gendered language fits them or represents them. We're not trying to exclude people who do feel that those terms represent them. So for people who
Right.
are women, using the word woman works perfectly. And I highly recommend that you do that because to
Mhm.
to call someone a birthing person when they feel like a pregnant woman fits them better,
Mhm.
wouldn't be including them and centering them in their care. And the
Mhm.
point of using inclusive language is to center the people that we're taking care of. So one of the ways that I talk with people about this is that if you're talking about someone in the abstract, using more neutral or inclusive language is likely to cast a wider net. So,
Mhm.
talking about the families that we serve rather than the
Right.
moms and dads,
Right.
where not all the patients might identify as moms or dads.
Mhm.
Um, but if you're talking about a specific family that is comprised of a mother and a father, those are absolutely the right words to use, and you would want to use them. Similarly, in an online group that I'm in, people have been trying really hard to use inclusive language to the
Mhm.
point that they're only describing birthing parents.
Mhm.
But if they're talking about a specific parent that they're taking care of that is a woman, she is a mother in labor, she does use the word mama to
Uh-huh.
describe herself, then that is the appropriate choice to use that. So it's not to the exclusion of anyone. It's really
Right.
just to make more space for people who are pregnant, who are dads, or who are not moms, or people for whom the term breast or breastfeeding might not fit their experience or might cause
Right.
trauma for them.
Absolutely. Absolutely. It's yeah, it's wonderful to hear that you say that. And let me ask you now, the next question is you also are precepting um, new midwives, correct?
Correct.
And reaching out in the community also, especially to queer and transgender midwives. Did I read that right in your bio?
Yeah. So when we have student midwives who are queer or transgender, I love to support them in
Yeah.
their training process.
That's wonderful. Absolutely.
Yeah, and it's wonderful to be able to take students into a practice where we get to do so many different aspects of care, whether it's
Hmm.
um, teaching them about lactation. And I strongly encourage anyone that's in midwifery to look into additional lactation training beyond what
Yeah.
um, their school training includes, because it's really the basics,
Yeah.
but there's so much more, and it's such lactation and midwifery are such good
Yeah.
partners together. So to be able to offer both of those skills. So
Hmm.
I do work with students on lactation training as well as well person care, contraceptive care, screening for and treating sexually transmitted infections, abnormal bleeding, any of the GYN issues,
Hmm.
as well as preconception care. We do some fertility in our clinic, including intrauterine inseminations, which I really enjoy doing, helping our queer families get pregnant.
Hmm.
Um, and then we have that continuity with them throughout their pregnancies and births.
Wonderful. Wonderful. One thing I'm also very interested in before I ask you about the presentation, I read that you practice mindfulness and include that in your practice. Tell us a little bit about that. That sounded so wonderful to me. So I want to hear more about that.
Yes. So I've been personally practicing mindfulness meditation for about 14 years,
Mhm.
and am just starting a teacher training program to be certified as a mindfulness meditation instructor. But one of the things about some of the things about mindfulness that I feel like make me a better clinician involve being able to be really present in the moment, that with what's happening right now, and
Mhm.
um, giving someone my full attention. It also includes elements of compassion and just being able to be open-hearted and grounded in what's happening in the moment without having strong emotions pull you away from that focus of what's happening right now. So it works well when an emergency is going on in labor to be able to ground myself
Mm,
and stay calm and focused, or when someone is having really big feelings, maybe they're going through postpartum depression and we're
mm,
talking through those feelings. It helps me not to be sidetracked by any of my own thoughts or emotions that would be going on, but to be able to stay present with them and focused on their needs.
wonderful. So I believe, yes, what you mentioned, mindfulness would be another good topic for everybody in the field to learn about and maybe practice or, get involved in for sure.
Absolutely. Maybe that's a topic for next year.
Next year, absolutely. And what you said earlier about talking to midwives about lactation, I can't even tell you how much I learned here since being with Gold in the field of lactation. And I keep talking to my midwife friends, like, did you know this? And have you heard about that? And look this up.
Mhm.
And it's been such a wonderful journey for me to learn all, so much about the field of lactation that our knowledge that we learn in midwifery school and our or in our training never comes close to. So I'm really grateful for that experience.
Yeah, it really doesn't. And as a nurse midwife who's also a lactation consultant, I've um, convinced probably 5 or 6 of my midwife colleagues and students to become IBCLCs as well, to get that
Mhm.
additional training and to be able to offer that to their patients.
Oh, great. Now let's talk a little bit about your presentation, Queer Milk Inclusive Lactation Care for LGBTQ plus families. So tell us a little bit about what you will be presenting on.
Yeah, so the goals of my presentation are really kind of a broad overview of how specifically people who work in lactation care can provide more inclusive care to queer and transgender families who are planning to breast or chest feed their babies. Um, and some of that's going to be talking about strategies in inclusive language, marketing materials, office environment, very practical hands-on things that can be done, um, forms, intake forms, specific questions that could be asked, things not to ask, things not to do, um, as well as going over some clinical scenarios, including induced lactation in both cisgender women and transgender women or trans feminine people who are wanting to breast or chest feed their babies without having been pregnant or been
Mhm.
pregnant recently. And we'll go through a case study that was published recently about a transgender woman who induced lactation to breastfeed her newborn. And then we'll also talk about non-binary and transmasculine people who um, have been pregnant and are breast or chest feeding, and
Mhm.
going through the specific both um, clinical as well as social needs that they might have that might differ from someone else who was pregnant but who was not either transmasculine or non-binary.
That sounds very exciting. I'm really looking forward to this presentation and the case studies and the tools you will be giving us.
Thank you. I'm really excited to present it and to share all this with everyone.
Well, thank you, Rob, so much for sitting down here with us just after being so sick and making it possible to come here and be here. We really appreciate it. It was really a pleasure.
My pleasure. Thank you so much.
And for our audience now, the presentation Queer Milk Inclusive Lactation Care for LGBTQ plus families will be live on April 14th. And if you want to find out more about this presentation and the other presentations in the Lactation Online Conference, please visit goldlactation.com. Thank you, everyone, and bye bye.
Thank you. Bye-bye.